Hi, my name is Lauren and I am a pelvic floor physical therapist. Today I want to talk to you about cupping or dynamic cupping. So this is not the cupping that you would see with people who have like bruises on their back, like circles on their backs. This is more of, it's less intense, I guess, a less intense version of cupping. Basically where you take the cup, a cup such as this is a plastic suction cup, and then you glide that cup along the tissue. So it doesn't stay in one place, it's not static. Instead, we take that suction, use it along the skin, and then glide it along the skin. And I will show you how to do it later on. So they have a couple different types of cups. You can have a bigger cup like this, smaller cup like this. They even make little facial ones that you can use on your face. I don't know too much about that. With cupping, you want to use a lubricant. So you can use a lubricant such as coconut oil, or you can use just your favorite lotion if you have any allergies. Whatever works best. That's going to be the lubrication, so just that you don't have friction along the skin so that the cup glides easily and without trouble. You should not do cupping if you have any of the contraindications. So if, for example, you have any history of like DVTs, deep vein thrombosis, if you have an open wound, if you have a history of cancer or active cancer, if you have any other skin conditions like eczema, things like that, you should probably not be doing cupping, but your provider should kind of talk to you about that beforehand. Okay, let's see what cupping actually looks like. I should also say that cupping is used to decompress the tissue. So basically, as you use the cup to lift the tissue up, that suction lifts tissue into the cup itself, and so decompresses the area below it. That means that the muscles, the skin, they all kind of lift up. It's really great for blood flow, so it's really good for healing and just making that tissue kind of move a little bit. Okay, getting set up for cupping. You want to be comfortable. I am doing my stomach in this example. We use cupping a lot for C-section scars to help the tissue move a little bit better and desensitize. So I'm going to show you on my lower abdomen here. I have blocked off with a towel my lower portion just so I don't get any coconut oil or lotion in that area on my clothes. I'm going to use lotion for this, so I'm just going to get some lotion on. So I'm just taking enough to kind of lubricate the area. I'm going to put it on the cup itself, so kind of along the edges. And then I'm also going to put it in the area, so on my lower stomach, just a lot of lotion. You might need to reapply at some point. So I've got lotion all along here. I'm going to start fairly light, so just not a lot of pressure, so I'm barely squeezing here. So a little bit of a squeeze, and then I'm going to put on my stomach, and now I can kind of glide back and forth like so. Barely any suction. As you start to use a little bit more, you'll be able to see it on the skin, feel it a little bit more. And I'm just going back and forth, just kind of getting used to that sensation, making sure it's not too much. You do want to start fairly light with this. So we can do this for as long as like 5 minutes, you can go 10 minutes, using a little bit more pressure as you continue your session. I'm going to use a little bit more now. So I'm using a lot more. You can kind of see a little bit of that marking on me. And I can definitely feel it a lot more, especially as I go across my midsection. So you don't have to just go back and forth. You can also go up and down, depending on what you're working on. This is very useful to do on the low back or the thoracolumbar fascia. Really nice mobility in that area. We can also do this cupping along the different muscles of our abdomen to kind of facilitate movement there. So you can go, if you have tension, more so along like your rectus abdominis, you're going to go up and down. If you have more tension along your obliques, your external obliques run this way, hands into pockets, versus your internal obliques going up the other way. So you can take the cup and go along that area, going down along the external obliques, going up along the internal obliques, going up and down along the rectus abdominis, or just going side to side along that transverse abdominis. So lots of different options for the stomach. If you're working on the C-section scar itself, I might post another video just to kind of detail that a little bit better. But for right now, this is all I have. So enjoy your cupping.